Hello, in this video I will provide an overview of the Flex Cushion. The Flex Cushion is designed to create a stable and comfortable seat foundation for the wheelchair user that presents with hip flexion limitations and asymmetries. The Flex technology and the strategic positioning base allows for quick on-the-spot adjustment, and like other Spex cushion options, caters for further postural changes that may occur. Like all Spex cushions, the Flex comes with an inner hygiene cover to protect the foam system. This cover encompasses each individual leg of the Flex cushion to allow for freedom of movement without compromising on foam protection from liquid ingress. The outer fabric cover has a dual layer top surface which can help to decrease shear forces, and the side mesh fabric provides breathability. The full surface Velcro fabric base covers the whole base of the cushion, which makes securing it to the wheelchair very easy and effective. We do recommend a second fabric outer cover so that these can be rotated during cleaning. Fire retardancy compliance requires both fabric cover and hygiene covers to be used. The cushion foam unit includes a pelvic support area with various foam layering for support. Individual thigh supports can be adjusted into various positions with the modified strategic positioning base wedges to accommodate and provide reinforcing support for hip abduction, wind sweeping, internal rotation, external rotation, and hip adduction. Positioning is achieved by adding or removing pads for pelvic obliquity, pads for hip flexion limitations or hip flexion contractures under the thighs. The Flex cushion includes chamfered front edges to accommodate knee flexion and tight hamstrings. Customizations are possible for greater hip flexion limitations or additional pressure relief. This cushion provides greater biomechanical responsiveness for those wheelchair users who previously required an open hip angle. This usually would be accommodated by reclining the back post canes, which causes the length of the wheelchair base to be extended. This can restrict access to the indoor environment, especially around tight corners, as well as potentially contribute to the development of neck flexion postures in the long term. The Flex builds support under the pelvis in order to accommodate some hip extension in sitting. This position allows for a more upright trunk posture within the seating system, reducing the overall wheelchair chassis length, as the back post canes do not need to be reclined so much. And it also maintains a more neutral head and neck position for freedom of movement. Anterior pelvic positioning supports must be considered to maintain alignment, and tilt options in the wheelchair base will allow for pressure and fatigue management. The strategic positioning base is simple to use yet highly effective to ensure wheelchair users are sitting according to their correct clinical evaluation, whilst bringing comfort, increasing sitting tolerance and decreasing pain. Thank you for watching.